Heart palpitations can present in different ways, and it can depends on where that extra beat or palpitations are coming from. The heart has four chambers, two on the top, two on the bottom. There's the right side and the left side. So depending where those extra beats come from can present differently. But what most patients will feel is like they'll feel like their heart's fluttering, like they'll do this, like I feel like my heart's beating out of the rib cage. Other patients may feel they have a skip beat, or some patients may go on to say that fluttering lasted so long that I became dizzy and felt like about to pass out. So it can present in different ways, but depending on where those extra beats are coming from. My name is Dr. Mahmoud Al Rifai. I'm a cardiologist at Houston Methodist. Heart palpitations are successive rapid beats of the heart that can come either from the upper or bottom chambers of the heart. If they happen just one beat, one extra beat, some patients may feel a skip beat. Actually, some patients may feel their heart pounding on the subsequent beat that happened after the skip beat. If that extra beat happened successively and over a period of time, some patients may feel those palpitations like their heart's beating out of their rib cage. And if they happen to the point where they're now compromising forward blood flow to the brain and the rest of the body, some people may actually experience lightheadedness, dizziness, and can even pass out. There's different arrhythmias, from what's called the atrial arrhythmias or the ventricular arrhythmias. Atrial arrhythmias, the most frequently cited, can be atrial fibrillation. That can actually lead to stroke because the blood pooling in the upper chamber is stagnant. It can lead to clots, and that clot can go up to the brain, can cause a stroke. Arrhythmias in the bottom chamber, or called ventricular arrhythmias, can be actually life-threatening, can happen after a heart attack, or can happen because of structural heart disease, and that can actually cause your heart to stop and can lead to fatal arrhythmia. So it can present in different ways depending on the etiology. Structural heart disease, so patients who have what's called cardiomyopathy, or they have an abnormal makeup of their heart, whether it's from genetics or from drugs or from other environmental factors. Structural heart disease is an important cause of arrhythmias or palpitations. Caffeine, actually, and herbal supplements can sometimes cause palpitations. Electrolyte imbalances, so if you're low on magnesium, low on potassium, that may also be a reason why some patients may have palpitations. Smoking can lead to arrhythmias as well. Alcohol abuse is another important risk factor, and also sleep apnea. As a matter of fact, patients who have atrial fibrillation commonly will have sleep apnea on top. So screening for sleep apnea and treating it can help resolve those arrhythmias as well. It's only when patients have symptoms, especially lightheadedness, dizziness, or passing out, as a cause to seek early medical attention. Minimizing any foods or drinks that can increase those extra beats. So caffeine, whether it's from coffee, tea, chocolate, energy drinks, herbal supplements. Commonly, I'll ask my patients if they're trying to lose weight, they're taking herbal supplements because those can actually increase hormones that can lead to palpitations. Limiting and stopping smoking and alcohol can also decrease the frequency of palpitations. And then making sure that you're well hydrated because electrolyte imbalances can sometimes lead to arrhythmias. Stress and lack of sleep can also lead to arrhythmias as well. So, kind of making sure you get a good night's sleep and managing stress. And then, lastly, I always ask my patients, do you have a family history of a relative who died unexpectedly? That's a high risk feature too, that because they may have some kind of genetic predisposition to an arrhythmia as well.